Hello, I'm Dr. Phillip Garcia. Today we're going to be talking about chemical peels. Chemical peels are intended to resurface the superficial part of the skin. They're intended to remove brown spots, fine wrinkles, discolorations, anything that lies on the surface of the skin. A chemical peel essentially resurfaces the superficial part of the dermis. It removes the superficial part to a layer that's pretty similar to where a sunburn would be. And in doing that, the new skin that grows in is healthier, more of the same color, and has a better texture. Chemical peels are very safe to do. Essentially, all we're doing is removing a superficial part of the dermis. The first type of chemical peel is a light chemical peel. This is typically a glycolic acid peel. This peel usually freshens the skin. It does not address any of the significant pigmentary issues of the face. The second type of peel is the medium chemical peel. There are several modifications that can be performed to the medium peel. With these modifications, the depth can vary. Essentially, a medium chemical peel is a peel that goes to the superficial part of the dermis, or that second layer of the skin. The medium chemical peel is intended to remove discolorations, brown spots, and it's intended to tighten the thin skin, especially that skin around the eyes. The third type of peel, which is a very rarely performed chemical peel, is a deep chemical peel. I essentially don't perform deep chemical peels in my practice unless there's extenuating circumstances or special circumstances. This peel takes a long time to recover, however, it's the most thorough peel in terms of removing wrinkling. The best time to have a chemical peel is when the light outside is less, for example, during the winter months. We generally ask patients to stay out of the sun for 2 weeks with chemical peels, so most of our patients have chemical peels during the winter and the spring. Some patients choose to have the peel in the fall as well. Many times chemical peels are performed simultaneously with other procedures such as a facelift or an eyelid operation. Many patients take the opportunity while they're asleep to perform the chemical peel, thus avoiding any discomfort. The recovery for a chemical peel is typically 2 weeks. Most patients are completely healed without any prolonged redness at that 14-day window. Usually about the third or fourth day, the skin starts to turn darker, and then that skin begins to shed off, very similar to a sunburn, for example. By about the 7th day, there's a light pink hue to the skin. Over the next few days, this pink hue or redness begins to get better, and the redness is usually completely resolved by 14 days after the procedure. If you have an upcoming event, I would recommend doing the procedure at least a month before the event. This ensures adequate buffer time in terms of your recovery so that evidence of your procedure no longer remains for your event. Chemical peels can be repeated as often as every 6 months or every year. It really depends on the problems one is treating. We have many patients that come back every winter and have a chemical peel. Essentially, there's very little downside to a chemical peel. All it does is resurface the superficial part of the skin with very little risk or complications with the procedure.